Did you know that severely high potassium in your blood could stop your heart in minutes? Potassium is also a component of a lethal injection, and it works by causing cardiac arrest. Let's break down why it happens and how to treat it fast. I'm Dr. Singh, board-certified internist, here to help make medicine make sense. High potassium in your blood is called hyperkalemia, and it's when your potassium level is greater than 5. Let's talk about some science. Potassium is an extremely important electrolyte in our bodies. It helps regulate electrical signaling in our heart, muscles, and even nerves, ensuring that they work properly. Potassium also helps regulate how acidic or alkaline our blood is. Our potassium levels are mostly regulated by our kidneys. Potassium is maintained in a strict range in our blood, and when it's out of range, it can cause life-threatening cardiac arrhythmias, muscle weakness, or even nerve dysfunction. So what could cause hyperkalemia? When our blood is too acidic, our cells will try to take up hydrogen to reduce the acid level and exchange release potassium in the blood, and this can often result in hyperkalemia. Another cause of hyperkalemia is reduced excretion, such as in kidney failure, where the kidneys cannot properly get rid of the potassium in our blood. There are also risks of hyperkalemia in patients that are on certain medications, such as beta blockers or ACE inhibitors. These medications typically don't do this in patients that have good kidney function, but it can be a higher risk in patients that have impaired kidney function. We always want to obtain an EKG when we see hyperkalemia to see if there are any changes consistent with the potassium level. An early sign of hyperkalemia on an EKG is tall, symmetric T waves, and we call these peaked T waves. As potassium levels increase, the PR interval prolongs. When potassium levels exceed 6.5, we start to see wide QRS complexes. When potassium levels are severely elevated, we may see a sine wave, and this typically precedes cardiac arrest. Management of severe hyperkalemia starts with IV calcium gluconate or IV calcium chloride. Calcium stabilizes the myocyte resting potential and helps prevent fatal arrhythmias. IV insulin and beta-2 agonists, such as albuterol, activate the sodium-potassium ATP. It pushes potassium from our blood into our cells and lowers the blood potassium levels. If you're using IV insulin, it's important to give dextrose as well to prevent hypoglycemia. Another important pump found in our cells is a pump that exchanges potassium for hydrogen. When the blood is acidic, hydrogen does not want to leak out of the cells into the blood because there's already a lot of hydrogen ions present. So we can give bicarb, which will raise the pH and allow hydrogen ions to come out into the blood in exchange for potassium. These mechanisms work pretty quickly, typically within 30 minutes to an hour. However, they can be temporary, so it's important to check the blood levels in about an hour or two to make sure that they're coming down and stay down. You can also try to eliminate potassium from the body, and this is done by loop diuretics, which inhibit the reabsorption of potassium in the kidneys, as well as things like K-exalate or patiromer. These bind potassium and excrete them in our GI tract. If hyperkalemia is severe or there are severe EKG changes, then it's very important to initiate emergent hemodialysis, essentially replacing the function of the kidney and filters the blood and immediately reduces the potassium levels. In summary, calcium protects the heart from fatal arrhythmias. Insulin, albuterol, and bicarb shift potassium into the cells, and binders, diuretics, and hemodialysis definitively eliminate potassium from our bodies. If you have any questions or experience with hyperkalemia, I'd love to hear about it in the comments. Like and follow for more educational content.